Welcome to Brain Wellness, the podcast. I'm your host, Mandy NP. Each episode will bring you a new topic or interview related to brain health and wellness as part of my mission to help you on the path to a healthier, happier brain. So, let's get started. Hello, everyone, and welcome back to another episode of Brain Wellness, the podcast. My guest today is Dr. Ayla Wolf. Dr. Wolf is a doctor of acupuncture and Oriental medicine, is a leading specialist in neurological rehabilitation, and the author of the newly released book, The Concussion Breakthrough, Discover the Missing Pieces to Recovery. She hosts Life After Impact, the Concussion Recovery Podcast. With over 20 years of clinical experience, she is known for her integrative approach to treating complex conditions like post-concussive syndrome, traumatic brain injury, dizziness, migraines, and dysautonomia. As the founder of Healing Response Acupuncture and Functional Neurology in Lake Elmo, Minnesota, Dr. Wolf combines applied clinical neuroscience with holistic therapies to deliver highly personalized care. She is an associate professor at the Carrick Institute and speaks internationally on concussion recovery and brain health. She is involved in ongoing clinical research on the effects of acupuncture for post-traumatic headaches. And prior to living in Minnesota, she served as the team acupuncturist for UFC and Legacy fighters at Fortis MMA in Dallas, Texas. That's kind of cool that you did that. So
It
glad
was
to have you
fun.
here.
It was fun.
Yeah, so I was reading that bio before when you sent it to him. I'm like, that is really cool. So yeah, I didn't even know that they did that kind of stuff for MMA. So very, very cool.
Yeah, and at any point in time at our clinic, my colleague who I share an office with, she specialized in fertility. And so at any given point in the waiting room, you'd have all of these like burly young fighters sitting there next to these 40-something-year-old women trying to get pregnant. So the waiting room was always an interesting, eclectic mix of people.
Right. What a combo. My goodness. Well, thank you so much for being here today. We did get to connect before we even did this show, and I'm so excited to be connected with you here in the Twin Cities area, and Minnesota in general. So
Yeah, well, and I would like to take this opportunity to say congratulations because I just saw on LinkedIn that you just got a huge award, top nurse practitioner in the state of Minnesota. So congratulations.
thank you. Thank you.
That's
Yeah, but
huge.
a lot of good things happening lately.
Yeah,
So
awesome.
yeah, I like when good things happen. As opposed to a couple years ago when not so good things happened. But, if that hadn't happened, we wouldn't have connected. So I'm really glad for that part.
It is important to kind of see those silver linings, isn't it?
Absolutely.
Mhm.
So, with that in mind, my first question is always kind of get a little bit about your background. So, how did you get to where you are today?
Sure. Well, I knew from the age of 6 that I wanted to be in the natural healthcare realm. So, as a child, I would go out into the woods and I would take barks and roots and leaves and stems and I'd mix it all together and I would create these healing potions. And so that was kind of, I guess, a blessing because when I was in college I always knew exactly what I wanted to study, which was medicine. And so all of my friends at that age were kind of clueless and they were just going to college and spending lots of money and not on courses and not knowing what they wanted to do with their lives. And I was just always on a mission, from day one. And when I was 15, I started working at a health food store. And so I immersed myself in understanding, even like herbs and supplements and what constituted a good quality versus a bad quality. And I mean, I remember at that age already understanding that you can't trust certain brands. And if they say they've got garlic in it, it might not have any garlic in it. And so even from a very young age, I didn't just jump on any fad bandwagon. I always had a bit of a skeptical mind and understood that there's a lot of snake oil out there. And I always loved having a scientific understanding of why does something help? What is the biochemistry behind an herb or a supplement or a therapy? So for some interesting reason, I always had a very scientific mind. And then I always had a fascination and a love of trying things that were natural first before immediately jumping into, hey, let's take a pharmaceutical drug, let's have surgery, let's cut someone open and try to fix them that way. So yeah, my whole life has been spent studying. My undergrad at the University of Minnesota was basically a pre-medicine program. And at that time, they had opened the Center for Spirituality and Healing. And that was a very kind of new concept at a university level, to have this center that was dedicated to alternative medicine and holistic healing. And so as an undergrad, I started taking all these graduate level courses. And then I also went and I studied naturopathic medicine in Australia for a year, came back, finished up all my pre-med courses, and then I ended up going and doing a master's program in Chinese medicine, acupuncture, Chinese herbal therapies, and then went into practice. I started right away specializing in fertility and reproductive medicine, and studying, functional medicine and, what we call like functional endocrinology. And so really understanding, again, not only the kind of alternative approaches to helping women who are trying to get pregnant, but also what was happening within the fertility clinics as well. And really, the fertility clinics embraced acupuncture, and they were bringing acupuncturists in to help with these pre and post IVF procedures. And so it was always a very integrative field. And during that time, I racked up a number of my own concussions. And so I have a love of high impact sports, snowboarding, wakeboarding, mountain biking, and then 15 years of martial arts. And so over the years, I had a number of concussions, and nothing that I didn't walk away from. But when you are 15 miles out into the middle of a mountain trail, mountain biking, and you crash, there's no coach on the sideline saying, hey, let's stop everything and do a quick concussion test. It's like, no, you get back on your bike and you go back, you bike the next 15 miles back to your car. And so I feel like all my concussions were things that I walked away from or rode away from. But definitely in hindsight, I could say, oh, wow, I was dizzy. I was disoriented. I was maybe a little nauseous. My sleep was off. And so in hindsight, I could look back and say, okay, those were in fact concussions. And I had two that were 10 days apart. And I remember in that moment, one of them was a mountain biking accident, and it was a pretty high impact crash. And then 10 days later, I had flown to Virginia. I was visiting my family, and some neighbors across the lake were they were wake skating. So this is like wakeboarding on a skateboard where you're not even strapped in.
Oh my gosh.
And me and my extreme sport mentality was like, hey, let's try this. It looks fun. And not only that, but you were being pulled behind a jet ski. So now I've got people pulling me behind a jet ski, and I'm on basically like a skateboard on the water. And so, of course, I face planted several times in my attempt to have some fun. And I flew home, and I had a layover in Denver, Colorado. And I looked at the board. I said, oh, okay, I have to go to gate E5 or whatever it was. And so I turned around, started heading to, E terminal. And then I took 5 steps and I went, wait a minute, what gate was that? And so I turned around, I went back to the board. This happened 5 times, where the second I started walking away from the board, it was out of my brain. I couldn't remember. And so the only way that I was able to make it to the gate was to chant E5, E5 through the entire Denver terminal to get to my next flight. And then I landed in Portland, and I was hungry. And so I went up and I got a to-go salad, and I walked up to the counter, and they said, would you like anything to drink with that? And I had no words. I literally couldn't respond. My brain wasn't working. And so I literally just handed them a $20 bill. I didn't say anything. I just walked off. I didn't even want my change. My brain just completely froze. And in that fog of concussion, I did not even know I was concussed. I didn't understand what was happening. I was just trying to get home. And I remember for 3 weeks after that, my brain was working in slow motion, and people would ask me a question, and my brain would say, someone just asked you a question. You have to come up with an answer. Okay, now you have the answer. Okay, now you have to speak that answer out loud. And it was just this crazy quicksand experience for 3 weeks. And at that time too, I just developed horrible insomnia. So long story short, I've had my fair share of concussions. I've had a lot of cognitive symptoms with brain fog. I've had a lot of sleep symptoms. I think I ended up dealing with a lot of depression and anxiety as a result of all my concussions and subconcussive hits. And so it got to the point where I did a complete 180 in my life. And I just said, I need to fix my own brain. I need to understand this. And I'm curious to see how acupuncture and Chinese medicine might play some role in this, whether it's herbal remedies or acupuncture strategies, or nutritional stuff. And I completely just uprooted my life. I sold my house. I sold the building my clinic was in. Everybody who worked for me basically went to go work for another clinic. And I sold my car. I rehomed my dog. I moved to Texas and I went back to school. And in my doctorate program, the entire focus of it was studying the brain, brain injuries, concussions, and pouring myself into all the research.
Yeah. Yeah. That's kind of a drastic way to take that passion a step farther.
I don't do anything half-assed. I've learned about myself. I like to joke, I like to laugh, but I'm also very serious. And when I set my mind to something, oh, it's game on.
That's awesome. I think that's why we get along because I say that all the time too. I'm like, I don't half-ass anything. I whole ass everything that I do. I'm 100% in. So I get you on that
Mm.
one.
Yeah, yeah,
So
absolutely.
what did you learn in all of that about Chinese medicine and acupuncture with concussion?
At the time, there's a lot of research coming out of China as well as Kyunghee University. I probably completely butchered that name, but in South Korea, there's some amazing research. And so I was reading a lot of the research on stroke and spinal cord injuries, and there's a lot of in China, they have complete like hospitals with whole departments for acupuncture. And so when people get a stroke, they'll literally get acupuncture every single day and in the hospital. And it's combined with all of the other medical doctors and medical interventions. And it's very much integrated
Hmm.
in different places. And so, with a huge population, they also have studies where they're looking at utilizing acupuncture for people who are in comas from brain injuries and looking at outcomes of, uh, you know, the Glasgow coma scale and are people actually recovering faster if we give them acupuncture while they're in a coma. They're not afraid to really run these kinds of studies and collect the data. So I read a lot of that data, but I also went down a lot of rabbit holes looking at brain inflammation because that's where I think herbal medicine can be really valuable is in helping to modulate some of these inflammatory pathways. And so I was looking at a lot of the blood biomarker research and looking at inflammatory markers. And so that was another rabbit hole that I went down. And then somebody, actually a naturopathic doctor, who was on the staff, on the faculty, said to me, well, hey, I know you're studying the brain injuries, and there's a conference happening through the Carrick Institute. This was in 2015. And it was their very first international symposium of clinical neuroscience. And so, not even knowing who the Carrick Institute was, I signed up for this. And then, given how busy I was being in a doctorate program, trying to conduct my own research and then still having a clinic and seeing patients, I completely forgot that I signed up for the conference. And then I think I got an email 2 weeks before it, and I didn't have a plane ticket, didn't have a hotel, completely forgot about it. And that was a moment that could have changed my entire life in a completely different way, because in that moment I said, I don't care that I am a broke doctorate student who's extremely stressed out and has 50,000 plates I'm spinning in the air. I'm going to drop everything and I'm going to buy a plane ticket. I'm going to figure out a hotel and I'm going to get myself to this conference. And when I went, I walked into a room of 200 of the smartest people I had ever met. And I listened to people presenting these incredible case studies with how they were helping people recover from post concussion syndrome using a functional neurology mindset and applied clinical neuroscience and neurorehabilitation strategies. And in that moment, I just said, I have to know everything these people know because they are changing lives in such a profound way. And so I have been studying with the Carrick Institute ever since and gobbling up, every single program they have. And it's been an incredible journey and it's changed the lives of so many of my patients. being able to incorporate functional neurology and applied clinical neuroscience and neuro rehab into the work that I do, and using acupuncture as a tool in that model.
Hmm. Hmm. And then you became an associate professor with them.
I did. They brought me on to help, I think, 'cause I spent a lot of the time translating a lot of their information into how does this fit into a Chinese medicine practice, or how can acupuncture be utilized as a tool with this model. And so they brought me in to try to create more coursework for acupuncturists who also want to have a better appreciation of helping people with neurological disorders. So I've created content for them, and I'm speaking. They have a women's neurology conference coming up. So I'm presenting on dysautonomia at that conference. And then there's synapse sessions conference in, I think, September, October. I'll be presenting on my research that we published in the Journal of Neurotrauma on acupuncture for post-traumatic headaches.
That is so cool. That is so cool. You have really kind of dived headfirst into all of this.
Yeah, yeah.
It's remarkable how people do that. And having had injuries previously and still being able to do all of this. So I'm assuming at some point you did the acupuncture and everything on yourself to help you heal.
I maybe not as much as I should have. When I first started my doctorate program, I felt like I was still having a lot of brain fog and difficulty with focus and attention. And I felt like it took me 5 times as long to complete an assignment, or to read a book and then, write a paper or whatever it was. And in the program was 4 years and I finished it in three. And who I was as far as my brain functioning at the beginning of the program compared to the end of the program, it was like a completely different person. And by the end of the program, I could sit on my laptop and I could read all these scientific papers, and I could write my own papers and create my own coursework and PowerPoints and presentations. And it was like, honestly, this might sound a little crazy, but just the fact of forcing myself to be in a learning mode for 3 years really intensively created so many different synapses in my brain, and was a huge part of actually healing my brain. And so I think just the nature of being stubborn and putting the time in and continuing to constantly learn new things was huge. Exercise was always, I think, a huge part of my recovery, is just always being very athletic and very active and doing a lot of different sports. And then when I started studying functional neurology through the Carrick Institute, I did an internship with a doctor, Dr. David Kemp, down in Jacksonville, Florida. And he did a lot of functional neurology for me, or with me. And I think that also really helped, because I think for a long time there, I actually had some visual issues that had never been fixed or even looked at. And so he did a lot to help me kind of get my brain back as well.
Mhm. I want to dive into the functional neurology for a minute, but I do also want to say I was just reading because I've been doing a lot of research lately too on the effects of when we tell people to take brain rest. So historically, we've always told people rest your brain, take it easy, don't do anything active until those symptoms subside, thinking that it was really rapid process for that to happen. But it's actually been proven that if you reintegrate into school work sooner than later, 48 to 72 hours is the only time that we want people to take brain rest now. You really do need to get back into that because it does help with neuroplasticity. So
Mhm.
I think forcing yourself to do all that education probably really was really good training for your brain. And having gotten just back into to work finally in February of this year, just these last few months, being back in it, working at it, reading all the things that I am now, and I'm taking coursework to become a certified brain injury specialist. Like all of these things are helping my brain recover faster too, and I can read faster than I was before. Still not where I used to be, but it's definitely that step in the right direction to actually get into learning something again because it does help with neuroplasticity.
Yeah, and I think in hindsight, what really helped me was the fact that I wasn't struggling with intense headaches. And so even if I was trying to study or trying to work, maybe I was struggling with concentration and focus, but it wasn't like every time I got in front of a computer, I'd have a horrible headache or extreme dizziness. And so I really feel for the people who are dealing with those particular symptoms, because that is difficult when you do want to try to push yourself and do things. And then the second you get in front of a computer or you start reading, boom, there's the headache. And that can be a difficult barrier when people are trying to, do the cognitive work.
Yeah, yeah. I was that other person, so I know that part of it.
Yeah, yeah.
So
Um,
jumping into the functional neurology then. So we've talked about functional medicine a few times on my show here previously, but functional neurology, how is that different? What did you learn about the difference in it? How does it make a difference in healing?
Yeah, I think that the way that I like to describe it is that functional neurology, because it's not necessarily like a defined discipline where you can go and then get, I have a degree with letters after my name that say I'm a functional neurologist necessarily. There are different like fellowships and board certifications kind of through the training program, but functional neurology really is a mindset that anybody in any medical discipline can embrace. And so you can have a medical doctor with practicing functional neurology. You can have physical therapists, chiropractors, acupuncturists, nurse practitioners, athletic trainers, that see their clients and their patients through a functional neurology lens. And so, there's different examples where sometimes when you learn a neurological exam, there's kind of like a line in the sand that says this is normal and this is abnormal. And when you're looking at something like eye movements, if you're asking someone, hey, follow my thumb back and forth, I'm going to look at your pursuit eye movements. Where's that line in the sand that says, okay, that's good enough or that's abnormal? It can be a little tricky, right? And Dr. Carrick just recently published a paper that was saying that male and female eye movements are actually different. And some women have an easier time doing some eye movements and versus men are having an easier time doing other eye movements. So wow, like that just opened a whole can of worms in terms of what's normal. And so, just like functional medicine can say, we understand that if you're having all kinds of thyroid symptoms, but your thyroid labs are kind of falling in our very large normal ranges, instead of just turning that patient away and saying, wait till you get sicker, wait till our labs show that you're worse. Functional medicine comes in and says, let's treat the person sitting in front of us. And if they're having thyroid symptoms, what other tests do we need to do, or what treatments might actually help this person to have better energy and lose weight and not have all these different symptoms they're having. And functional neurology is the same way. We're meeting the person with where they're at, and we're saying, how can we help improve this person's nervous system and the way their brain operates to help them function better in the world?
Mhm. And how then does neuro rehab come into some of that?
Yeah, the beauty of it is the emphasis on the integration between all the different systems. And so in medicine, people tend to get very siloed. I'm an eye doctor, I'm a dentist. I only look at the inner ear, right? The ENTs, right? And so we get very siloed into I'm just looking at like one part of the body. And functional neurology is all about how do all of these symptoms integrate, or how do all these systems integrate together. And so we understand that jaw mechanics play a role in someone's balance. And when we're talking about somebody with a concussion who maybe has dizziness and disequilibrium and sensations of like rocking or swaying, or they just feel off, what we have to come in and say is, okay, we have to understand what is the visual system doing, where there may be errors within how that system is communicating with the vestibular system and with jaw mechanics and with cerebellar function. And so we're constantly saying, okay, we've got to find out where these errors are in the system and clean up those errors so that the person doesn't have disequilibrium or these other symptoms. And so it's all about integration. And that's where, we can say, okay, I'm going to have you like touch my finger and then your nose. And we have the patient go back and forth and like, okay, finger, nose, finger. And then, well, what happens if I tip your head back into extension and I have you do that same test, do we see that your motor output breaks down when your neck is in extension? And if so, well, now we're like, okay, what's going on? Is that a canal issue with the vestibular system? Is that a cervical issue? Or like if we, are testing the pinwheel on somebody and it's really sharp and painful on, the right side of the face, and then we have them open their jaw and we test the pinwheel and now it's not sharp anymore. Okay, well, clearly the jaw position is playing a role in someone's pain perception. And so we take kind of classic exams and put a bit of a functional twist on it to say, let's change the parameters. Let's do this test in all different kinds of parameters to say, where's the breakdown between the different senses and how they're communicating with each other in the brain.
Now you're making me think I need to go to the Carrick Institute too.
Mission accomplished.
So
I know you would
cool
love
things.
all of the course
My
material.
gosh. Like just the little snippets that I've got as I've met different people along this process has been just fascinating to learn how different things can come into play. Like just the use of a compression brace on my wrist was one thing that came up. I'm like, how does that work on the autonomic nervous system? Like seriously, how does that work? So kind of going down that little rabbit hole and reading that, it's I think I can go really deep with all of this. This is a problem, but
Yeah. At one of the Synapse sessions, I presented a bunch of kind of data on there was a study that was looking at balance, and they were doing dynamic computerized posturography. So they were doing sway testing, and they found, and this was on people that had a whiplash disorder, so neck trauma, and they measured people's balance and how much they were swaying when their eyes were closed on this balance plate, and then they gave them custom fit dental appliances for like changing their jaw mechanics. And then they tested them again, and boom, their balance was much steadier. And so I read this paper and I'm like, okay, well, I'm not a dentist and I'm not giving people dental appliances, but if the jaw is really important for balance, what happens if I do acupuncture at points along the temporalis muscle, the masseter, the pterygoids? What if I get in and actually like loosen up tension within these jaw muscles? And so I started to test this, and I have an iPad that uses an internal gyrometer to measure the degree of somebody's sway as they're balancing with their eyes closed. And so I had a patient with disequilibrium and a lot of vestibular symptoms, and she had jaw issues and TMJ dysfunction. And so I measured her balance, and it was about 60% out of 100. They kind of give you a score, and you test people with their feet together, eyes closed, and then tandem stance, right foot in front, eyes closed, and then left foot in front. So those are kind of the 3 testing parameters. And then they take your combined score and give you a kind of overall percentage. And so it was about 60%. So then I put the acupuncture points into those 3 muscles that we use for chewing. And I measured her again with the acupuncture points in, and her balance shot up to 90% with just having these acupuncture points in the jaw. And now, like, that's, you could say that that's just a party trick if it's just a one-off, and as soon as you take the needles out, the balance breaks down and, it's worse. But I got to, continuously monitor her over time, and her balance consistently stayed better right up until she got a sinus infection and had all this sinus symptoms. And then it kind of fell apart a little bit, but we got her better again once she got over the head cold. And so through just read that, so that's kind of an example of how I'm reading the research and saying, how can I apply what they're discovering in the research using my tools, and then actually having objective data to measure outcomes. And so that's kind of been my journey of discovery to say, acupuncture can be very powerful, but if you're not collecting objective data in terms of what people's eye movements are doing or what their balance is, you're missing the beauty of what's actually improving within somebody's nervous system when you don't do the pre and the post exams.
Yeah. Yeah. So how about, can you give an example for like headache? Because headache is the number one symptom that does bring people in for treatment. What would you do in that case?
Yeah, well, that is the very outside of the introductory chapter to my book, that is the very next chapter. And so part of where I start is making sure people have the right diagnosis, because a lot of post-traumatic headaches mimic migraines, and they get incorrectly diagnosed as migraines.
Yep.
And the research basically says that migraine medications, unless you're actually having true migraines, they don't always help people with post-traumatic headaches. And so we have to kind of figure out, is this headache as a result of dysautonomia? Is this headache a result of maybe some eye movement disorders that are causing constant strain on the visual system? Is it a cervicogenic headache that's coming from some neck trauma? Is it more of just the trigeminal system has inflammation, and now we've got this kind of central sensitization of pain coming from that trigeminal system? And so those are kind of some of the differential diagnoses that I go through in my mind to say, do they have the right diagnosis or not? And are they maybe taking medications that aren't actually helping them? And I usually start with a lot of autonomic testing to just say, how is the autonomic nervous system? Usually there are some issues there because that controls blood flow in the brain. And so when it comes to acupuncture, my strategy is very much dependent upon what am I treating. If it's a cervicogenic headache, I'm going to be doing a lot of acupuncture points on the neck. And I also use a peripheral nerve stimulator that uses a pulsed radio frequency that's incredible for restoring healthy, proper function to nerves. And so, instead of maybe, as an alternative to say Botox, these peripheral nerve stimulation devices can sometimes, be a more natural therapy that helps to restore nerve function and nerve health so that people have less headaches and less pain. And then also I use pulsed electromagnetic frequency. So I use a PEMF device. And by restoring healthy vasomotion to the arteries, a lot of times that can really reduce head pressure and head pain. And so I'm using a combination of, acupuncture, also referring people out for like osteopathic manipulation, chiropractic if they need it, and then also utilizing the PEMF and the peripheral nerve stimulators, really with the idea of let's reduce inflammation, let's restore proper nerve function, and let's basically restore healthy vasomotion to all these arteries that are supplying blood flow. And so those are kind of the big ones that I've been going towards. Transcranial magnetic stimulation has phenomenal research to say that it's very helpful for chronic persistent headaches. And I had a patient through the VA. The VA actually paid for her therapy, and it was very helpful for her. So I'm about to interview somebody who uses that in his clinic too for my podcast. I'm very excited to have that conversation with him.
Yeah, very cool. Very cool. All of those things are things that I've kind of touched on along the way as well. Some of them I've tried as a patient, some not. But it sounds like a very common conversation that I have with my patients with headache also, going through coming with it, or excuse me, what's causing it, what is actually the root cause, because I do also say that everybody gets diagnosed with migraines and it's not always migraines. So
Yeah.
yeah, that's a
Mm-hmm.
lot of clarification that I do when I'm seeing patients too.
Yeah. And, as an acupuncturist, I'm not attached to acupuncture as a tool. And so
Hmm.
sometimes it works right for people, sometimes it doesn't do much.
Hmm.
And so, like I said, I'm not attached to the tool. I'm just attached to the outcomes. I just
Yeah.
want people to get better, whatever therapy is going to move the needle for them.
Yeah.
That's what I'm supporting.
Yeah.
And so the term, the term licensed acupuncturist is a little frustrating because it gives people the sense of like, oh, that's all you do and that's all you know.
Yeah.
Whereas like actually, there's a whole lot more to what we're doing here.
Yeah. It was the stepping stool that got you into the functional neurology.
Yeah, exactly.
Yeah, very cool. So thinking about that, you mentioned your book. So let's go ahead and talk about that. So you've got this book that you just published. So tell me a little bit
Yes.
more about it.
Yeah, hot off the press. So I didn't start out thinking I would write a book. I started out, I wrote a 6,000 word ebook, and the 6,000 word ebook turned into a 600-page book, basically. And so that was kind of an interesting process. But what I what I think is unique about my position is that as a Chinese medicine practitioner, the people who come to me, they are I am usually like the very last person they see. I'm the last hope. They come to me after they've already seen 10 to 15 other different doctors and healthcare providers, and they've spent all their money and they're hopeless. And then somehow they find this crazy little acupuncturist who apparently specializes in brain injuries, and they come in. And so my position has always been like every single case that walks in my door is kind of a complicated case of persistent post-concussion syndrome. And it's in my mind, I'm like, okay, it's up to me to try to figure out what got missed up until this point. And so I've always had the complex cases, and I've always had to work really, really hard and do a ton of different exams and weird exams and one-off exams and looking here and looking there and trying to find like the needle in the haystack for like what is holding this person back. And so that's kind of my perspective and my angle is that I've only ever had the really difficult cases. And so I've been in a position of really doing a ton of patient education, and I feel like so often that got missed. People would come to me and say, well, yeah, I went to a physical therapist. And I'd say, well, what did they diagnose you with? Or, do you have a peripheral vestibular disorder or a central vestibular disorder? Or they'd be like, well, I don't know. And I'm like, well, what therapies did they give you? I don't, they had me run on a treadmill. I don't know. And so the patient couldn't communicate with me, like whether or not they had a clear diagnosis about what was driving their vertigo, for example. And they couldn't explain to me why they had done certain exercises or what the goal of those exercises were. And then oftentimes they'd say that they didn't get better, or the exercises made them worse. And so now they're in my clinic and they're, like I said, just like out of options.
Yeah.
And so my book is really for those people. My book is for the people with persistent post-concussion syndrome who have already tried a lot of things. And my book is a giant troubleshooting guide. And so because concussions and brain injuries are so complex, my book is very big and long. And I gave people a system, and I just said, okay, let's have you fill out this questionnaire and let's break it into basically 9 different categories. And so by filling out the questionnaires, if they don't have any symptoms in a certain category, well, they can skip that chapter. They don't have to read. If somebody is sleeping like a champ, they can just skip chapter 9. But so by filling out the questionnaire, it gives people a guide to say, oh, well, I'm scoring a lot of symptoms in this dysautonomia category. Nobody's ever really examined me for this. So then they go to chapter 4 and they get to fill out an even more in-depth checklist of symptoms and start to understand the scope of symptoms that somebody can have or experience if they've got dysautonomia or autonomic dysregulation. And then I get into, well, here's a lot of the tests that can be done. And here are some tests that require a lot of high tech equipment that in Minnesota, like Hennepin County and Mayo are doing for autonomic testing. But then here's a bunch of other functional tests that exist that don't necessarily require tech. And so I'm laying out, here are options for what are the exams and the tests that are available. And then here are some of the research kind of based therapies that might help you. And so each chapter is really all about here are the symptoms that you might be experiencing. Here's why you're experiencing them. Here are some of the really important tests that are out there in the world that you can find. And then here's some of the therapies that maybe nobody ever talked about, or you haven't tried, or nobody, brought up. And here's the research on those. So that's kind of the book in a nutshell. So the categories are post-traumatic headaches, traumatic neck injuries, dysautonomia, cognitive dysfunction, vestibular imbalance issues, ocular, motor, and visual dysfunction, mood disorders, sleep disorders, and then brain inflammation. So those are the 9 categories that I get into.
Mm-hmm. That's a really neat way to do that. Have them do the questionnaire and figure out which sections they really need to focus on. Because I think sometimes people can get kind of lost in the woods when they're looking at all these different symptoms that can happen with concussion. So it's really trying to narrow in which ones are going to be important for you. I think that's a really neat thing that you did there.
Yeah, my publisher said that 90% of people that buy a nonfiction book never make it past chapter one. And so that was my way of saying, hey, let's fill this out in chapter one. And then hopefully, you don't feel overwhelmed. You have to read this book cover to cover, but you
Yeah.
can like skip around and read, the chapters that are applicable to you.
Yeah. You should put maybe the most common one at the end so you can say that they did do the book cover to
Ah,
cover.
there you go. There you go.
No, that's a really cool way to do that, though. Just really kind of narrow in and get them exactly where they need to be. Because that's people do, they get lost and they're trying to figure out what do I need to do next. And I had a patient come in and see me this week, and he is 2 years post-concussion. And he said, "Is there anything else you can do for me?" And I said, "I have a whole list." So, yes, there are things that we can do because I'm not doing traditional medicine where it's just PTOT speech. I've got more of the functional neurology part in there too. You're on my
Yeah.
list of referrals. So all of these different options that people can go to that they just don't know about yet.
Yeah. Well, and I feel like we need like a million more U's in the medical
Yeah.
system doing that kind of work.
Yeah, yeah. I realize that I'm a unicorn in many senses. So yeah,
Hmm.
that's all right. I wish there were more of me as well. And that's the next thing to do is try to advocate and educate more practitioners, which is why I do this thing on the podcast to try to get more people listening because there are quite a few practitioners, nurses, physicians that listen to the show. So just getting this knowledge out there and letting them know what the options are and what can we do for patients. So it's not just the simple little cookie cutter thing that we thought of 20 some years ago.
Yeah. Yeah. And that's, I think what's difficult is when, there isn't a clear standard protocol because everybody's coming in with completely different symptoms.
Mhm.
I mean, I have some patients where they have severe vertigo, but they don't have any headaches. And then I've got some people that have, absolutely no issues with their balance or their vestibular system, but they're suffering from massive cognitive symptoms. And so everybody needs something completely different.
Mhm.
And that takes time. And obviously, in kind of mainstream medicine, doctors are operating with very little time.
Yeah.
And that's a big barrier, I think, for people with these complex issues.
Yeah. Yeah. I've been blessed with having a lot of time in clinic. So I use it and we go really deep into their symptoms and people are astonished by some of the things that we talk about that are related to their brain injury that they never knew. They had no idea that those things were related. So um,
Hmm.
hence why we talk about it all here on the show.
Exactly. Yeah. Yeah. Just shine a light on all the symptoms.
Yeah. Yeah. So, where can people find you if they want to learn about your book, about your practice, about anything that you're doing?
Yeah, right now the best place is my website, lifeafterimpact.com. And that's where I'll have information on the book and the podcast. The podcast is, on all the major streaming platforms, but I also have a dedicated page for each episode on my website. So people can listen to it there. And then my clinic is in Minnesota. I also see people out of a clinic in Manhattan in New York, the shoe clinic. So I go there once a quarter and see people. And then I'm also licensed in Florida as well and Wisconsin. So I see people twice a month in Wisconsin. I do some telemedicine in Florida. So I've got licenses in a couple of different states, but obviously my main hub is my Minnesota practice. And that is the website's healingresponseneuro.com.
Very cool. Any last bits of wisdom that you'd like to share with our listeners as we wrap up today?
Never give up hope. There's something out there that can help you to just take that next step forward.
Mhm.
Yeah, the brain is so powerful in its ability to heal.
Mhm. Yeah. Great words to end on. Thank you so much for being here today, Dr. Wolf.
Yes, thank you for having me.
Yeah. Thanks for tuning in to this episode of Brain Wellness, the podcast. If you enjoyed this episode, I encourage you to subscribe, like, and share this with others to help me continue on with my mission to help people live healthier, happier lives. Go to www.brainwellnesssolutions.com to see what I'm up to and get links to all the social medias there. See you next time.